In this video, we are going to be showing you how to use the iTero scanner to scan the upper and lower arches as well as the bite registration. We'll be showing you how to do the bite registration and to confirm that your bite registration is correct. So what did you select there?
So you'll go to iRecord, and then you can add whichever labs that you want to under this. I'm going to click on Presomnus. And then you can put any notes that you need to, but usually I don't put anything in there. And then you'll just click on the wand. So if you want to start on the upper teeth, you can start upper or lower, it doesn't really matter. So you'll just click on the upper arch and turn your scanner on. I usually start on the very back molar and get all of the occlusal, then go towards the lingual with the anterior teeth, and then back to the occlusal on this side. And then I go back and get the lingual. And then I go to the buccal, so I'll have the patient close down just a little bit. Okay?
Mm-hmm.
And then last, I'll just go back and get the incisal edges. Just like that.
Beautiful.
And then if you hit this, that will show you if you're missing anything. So any places that you're missing will come up bright blue. So everything looks filled in. And then for the lower, you'll just go back to the wand and then click on the lower teeth. Okay.
Mm-hmm.
And then the light blue places like this are typically okay. If it's a bright blue, those are places that you'll want to go back over if it's like a darker blue color. Okay, so this is the 6 end-to-end airway metrics. So what you're going to do is you're going to just insert this into the black fork part, and then on the handle will just slide in to that little slot, just like that.
There a little bit. Perfect.
So her top teeth are going to go right into that center slot, and then her bottom teeth will go into that one. So you're going to put the material on the top first, and you don't need a whole lot. Okay, then you're going to open.
Lovely model.
You just want to make sure that it's in the center of 8 and 9, and then have the patient bite down. And then make sure that their lower teeth are in that notch.
Perfect.
And then you're just going to have them hold there.
And I want to point out here that the bite positioner is not exactly between 8 and 9. It's not critical that it be between 8 and 9 as long as the bite relationship is good between the upper and the lower teeth.
Okay, and then you're just going to hold on to this and have the patient open. And then you're going to put a little bit of material on their posterior teeth. I usually go up to the first or second premolar. And then you'll have the patient bite down and just, again, make sure that their bottom teeth are in that notch. Open. So it'll look like this. And in order for the scanner to pick up the bite, sometimes you'll have to trim a little bit of the excess material off. So I just take a 12 blade and trim a little bit off the outer side so that it shows more of the teeth. And sometimes if you don't use a whole lot of material, you won't even have to trim any off. So just like that. And then what you're going to do is place it back in the patient's mouth. Maybe. Okay, now bite down. Open just a little, now bite down. Okay, so now we're scanning the bite, and so you see how it popped up that kind of grayish or brownish color? That means that it captured the bite. So there we go, got that side. And then both sides should be purple.
Look at that beautiful midline.
Perfect.
Now open just a little bit. Good. You see how she sort of goes to the right. She sort of deflects to the right a little bit. Okay, then close again. And then open just a little bit. Good. And then kind of stick your lower jaw forward a little bit. Good. Okay, perfect. I wanted you to see from that last clip of the patient opening and protruding how she deflects to the right, to her right. And that's important when you're looking at the bite to make sure that that corresponds with the way your scan looks or the way your impressions look or your bite looks. Just make sure that you are replicating what the patient naturally does when they're opening to whatever position you have them in for the bite registration. So if it's 6 end to end, 6 vertical, 2 protrusive, 6 vertical, 3 protrusive, whatever that is, make sure that it corresponds correctly with the way the patient just naturally moves their jaw. In a case like this, I would just double check that. I try to double check most of the bites that we do just to make sure that that is the way the patient opens and that we're capturing the bite at the correct position. So have them just use the bite positioner one more time without the bite fork in and just take a look visually from the front and laterally to make sure that your bite is correct. This is the most critical part and you want to make sure you're getting that as close to perfect as possible. And the last thing I'll mention is that you may have someone with crowded teeth, crooked teeth, so it may not be easy to get the bite positioner right between 8 and 9 on those patients. So you can put it on 8 or 9, or however you can position it where the patient can hold it pretty comfortably and securely, and you can still get the bite correct. You just want to confirm that that relationship between the top and the bottom teeth is where you want it.